Resistors and preppers can divide wound treatment into three distinct phases: initial care, cleaning, and long-term care. A fourth phase would be surgical care, such as closing off an amputated extremity, but those procedures require knowledge and equipment beyond what this video can provide. Initial care takes place at the time of injury and may include self, buddy, or medic care with your blowout kit, tourniquet, or battle dressings. In combat, initial care may be treating a gunshot wound. In a prepping situation, this might be a leg injury from a chainsaw. Initial care is the immediate administration of first aid to prevent further injury or death. It allows you to continue with the mission, or if needed, stabilization of the injury so you can be evacuated to a higher level of medical care. In initial care, you're not as concerned with cleaning or closing a wound as you will be in later treatment. The cleaning phase in wound management is removal of the initial dressings or interventions from initial care, cleaning the wound of debris and devitalized tissue, and covering or closing the wound for it to heal without an infection. If the wound is not closed, you will continue to clean and take care of the wound as it heals. Long-term care is to continue to provide ongoing wound management and assist in patient recovery. This would include nursing care, IV therapy, especially after burns, preparation of food, cleaning and redressing of wounds, cleaning of the patient laundry such as bed linens, prevention of infection, and safety and security of the patient in a removed or at least protected location. I keep my wound cleaning supplies in a clearly labeled tote. If possible, I try to use a red colored tote to designate medical supplies. If you can't find a red tote, label the outside in multiple places so anyone can recognize the tote. It'd be a good idea to keep a contents list on the inside and on the outside of the tote. The supplies I have in quantities are just an example. You may want to change products or amounts to suit your needs. I'll place a contents list below in the comments. The contents are kept in Ziploc bags, and everything else is kept inside of a contractor bag to prevent water damage. I try to keep the items packed in there in order of how I would use them. For wound care, it makes a good idea to have all your supplies together in one place for ease of use. On the inside, I have a list of everything that's inside the tote. The supplies are protected by a contractor bag, and inside is another list of everything inside the tote. On the top, I have my PPE supplies. Hand sanitizer for use before and after care. $20 pair of gloves. I'm not worried about searching for injuries, and this probably isn't a tactical environment, so any color works. Four protective gowns to protect you and your clothing, and to keep contaminants that are on you and on a steer working in an area from falling into the wound. Four face masks to protect you from blood splatters and the wound from your saliva, sweat, and germs. Four sterile fields to give you a clean and protected work area. Cut a hole in the sterile field appropriate for the injury area you're working on. You may need to secure the sterile field with tape to hold it in place while working. Next up would be my wound cleaning tools. And chlorhexidine. And an empty bottle for diluting it. My wound cleaning supplies consist of 4 small garbage bags to gather and dispose of soiled supplies, including bloody clothing and used dressings so you don't make a bloody mess of your work area. You may also want to have a small dish to place objects removed from inside the wound site during debridement. EMT shears to cut away clothing and dressings, 2 razor blades to shave hair from around the wound site, especially on the head, 20 medical swabs for cleaning and removing foreign contaminants, soft bristle baby hair brush for gently scrubbing and cleaning inside the wound, baby shampoo to clean blood from hair and skin so you can better see what you're working on, 2 60 ml syringes for flushing a wound with sterile water, saline, or chlorhexidine, 2 washcloths for cleaning around the wound. To clean and sterilize around the outside of a wound, I have a 32-ounce bottle of 2% chlorhexidine. I can dilute it to 0.5% for irrigation and cleaning inside of the wound. There is an empty 32-ounce bottle with printed instructions taped to it to make the 0.5 solution. Chlorhexidine won't injure tissue like hydrogen peroxide or betadine. I have my wound debridement supplies and instruments. You will need to remove devitalized or contaminated tissue and foreign debris from the wound to prevent an infection during healing. My wound debridement supplies include a scalpel handle, 3 number 10 scalpel blades, 3 number 11 scalpel blades, Addison forceps, which can also be used for applying steri strips, straight scissors, curved scissors, hemostat, and tweezers. I have my wound closure supplies. My wound closure items include 2 2% lidocaine syringes for numbing around the suture site, and 2 injection needles for lidocaine injection. 30 gauge needles are less painful for injections, while I had were 25 gauge on hand. Dermabond, which can be used as a skin glue. For more superficial wounds, I've used gel superglue many times. Assorted size sutures, skin stapler and remover, steri strips, and benzoate tincture to assist the steri strips in adhering to the skin by making the skin stickier. And medical tape. It doesn't have to be medical tape if you don't have it. Electrical tape or duct tape will work just fine. I have a variety of gauze for wound packing, covering, and cleaning. You will need large amounts of fresh gauze for a severe injury as it heals. To keep the wound care totes small, light, and organized, I keep only enough inside to treat a few wounds with other totes containing more gauze to restock my wound care tote. If money or resources are limited, then focus on getting as many 4x4 dressings as you can. It wouldn't be a bad idea for a prep or medical supply to have hundreds of 4x4 dressings packed away, because you will use more gauze than you can imagine. My various gauze I have 2 of the medic toss bags. I covered in another video. Each one has a 5x9, 10 4x4 dressings, 2 Curlix, 2 roller gauze, 1 Vaseline or non-adhesive dressing, and 2 pairs of gloves. 10 count of 5x9 ABD dressings. A bulk loose pack 200 count 4x4 dressings. .25 count loose 4x4 dressings individually wrapped. 6 petroleum gauze or other non-adhesive dressings. 3 tray pack 4x4 dressings, 20 count each. Four packages of 5 count Curlix rolls. 10 4-inch roller gauze. 4 ace bandages. When finished with your wound care, you'll need to disinfect or sterilize your instruments so they are ready to go for their next use. To sterilize the stainless steel instruments without an autoclave, clean them thoroughly with a brush and solution of bleach, 70% isopropyl alcohol, or 6% hydrogen peroxide to remove all blood and tissue, then wrap them in aluminum foil. Place the instruments wrapped in aluminum foil in your oven. Bake in the oven at 400 degrees Fahrenheit for 30 minutes. After it cools, store the instruments still wrapped in aluminum foil in a Ziploc bag. You can also sterilize the instruments by soaking them in boiling water for 20 minutes. If you don't have the ability to bake or boil, you can soak the tools in bleach, 70% isopropyl alcohol, or 6% hydrogen peroxide for 20 minutes to disinfect, which kills most but not all bacteria. An important product for austere non-suture wound closure that's not kept in a tote is granulated sugar. I store granulated sugar in 5-gallon buckets as shown in my other videos. I don't store it in the tote because of the large amount that is needed for packing wounds. Some people also use honey in place of granulated sugar or a mixture of betadine and sugar. Granulated sugar helps in a granulation phase by osmotic reaction. It draws fluids into the sugar to prevent infection, and the wounds heal from the inside out faster and with less chance of infection than not using sugar. It is simple and requires less skill than suturing. To use granulated sugar for wound healing, debride and thoroughly clean the wound. Dry the inside of the wound with sterile gauze. Pack the wound with dry granulated sugar, making sure it gets into all of the wound, and cover the site with a dressing. 3 times a day, flush out the wound with saline or sterile water, dry with gauze, repack with sugar, and cover. You want to make sure you clean the wound 3 times a day or the fluid-saturated sugar will cause an infection. I've used this many times and it does an amazing job. Another important item for wound treatment is antibiotics. I keep mine stored with my medications and not in the wound tote so they can be rotated. Moxifloxacin and a combat pill pack should be immediately taken with every penetrating injury during initial care to greatly eliminate possible future infection. I will cover this in a future blowout kit video. A good understanding of which antibiotics to buy, dosage, and when to use each type should be learned ahead of time. The best resources you can help get started on antibiotic use are the physician's desk reference and the nurse's drug handbook. Another tool for wound care under very austere conditions is maggot therapy. This is basically exposing a wound to flies for them to lay eggs into. The eggs hatch and the maggots will start eating the necrotic flesh first. The wound will become painful and bleed as they move on to living flesh. At this point, flush the maggots out with sterile solutions. If you don't have sterile fluids to flush them out with, you can use the patient's own urine. This has been used for success around the world for centuries and should be considered another tool in a toolbox for worst case scenarios.